Hello, my name is Commander Dennis Spence. I'm the Chair of Research Education and Facilitation at Naval Medical Center, San Diego, California. In this podcast, I'm going to be talking about how to formulate a research question. I have several objectives for this podcast. First, I will review the research process. We'll describe how to formulate a problem statement, research question and specific aims, and hypotheses. And then we'll review some examples. So what is the research process? Well, first step is to identify a problem or a research question to be answered. Maybe you're interested in postoperative nausea and vomiting in women undergoing gynecological surgery, and you're interested in seeing if a new medication will decrease the incidence of postoperative nausea and vomiting. You also might be a new theory that you want to test, and you want to do some research to evaluate it. So, thinking of the research process, first you identify a problem or a question to answer, and then you review the literature, you formulate a purpose statement, research question and specific aims, and hypotheses if applicable. Develop a protocol to answer that question and address those specific aims or objectives. You execute the research plan. You analyze the data. You prepare your manuscript, your poster, your abstract for publication and dissemination. And you evaluate the research report. First step in the research process, or when you're writing up a proposal, is the introduction and the background and significance. This is where you're telling the reader or the reviewer why you need to do the study, why it is important. It answers that so what question. And it should address the problem, question, or theory that you're testing, any work that's already been done, with specific focus on shortcomings or gaps in the literature that you have identified, which your research will help fill. And finally, your introduction and your background and significance section typically will conclude with a purpose statement and some research questions and specific aims, and if applicable, research hypothesis. The methods section of a research proposal is how you will answer that question. It provides information on the design and overview of the study, the setting and sample in which the study will be conducted, a description in detail of the intervention if applicable. You also will present information on the variables that you're measuring and the data collection tools that you'll be using. You'll describe in detail the research procedure, the statistical analysis and how you came up with your sample size, if applicable, and address any human subject issues. One of the problems I've seen with novice investigators is that they tend not to provide enough information in the methods section when they're preparing a proposal for submission to an IRB. My general recommendation to investigators is that it's better to provide more information in greater detail so that leave nothing to question when the reviewer is deciding whether or not to approve your study. Now I'm going to go over a few terminology that you need that will help you as we go further through this podcast. The problem is the condition which you are planning on investigating. The question or the research question is a statement which the researcher wants to answer with this research proposal. In a hypothesis, you're making a prediction concerning how to solve the question or address the problem. The specific aims or objectives tells exactly what the researcher hopes to achieve by conducting the study. The dependent variable is the outcome variable of interest. This is the variable that is hypothesized to depend on or be caused by another variable, the independent variable. In our example I just mentioned, the dependent variable may be the incidence of postoperative nausea and vomiting in a certain population. The independent variable is that variable that is believed to cause or influence the dependent variable, or if you're doing an intervention study, this may be the treatment. For example, this may be a new medication that you're administering, and you want to randomize patients to receive either this new drug or placebo. That new drug would be your independent variable that is influencing the outcome, or the dependent variable in this case would be the incidence of postoperative nausea and vomiting. So when you're formulating a problem statement, this is the first part of the research proposal. And this is a key step in the process of developing a strong research study. It underlies the success of the project, and it should be based on your practical experience with the topic, your critical appraisal of the scientific literature, and your interest in the topic. When you're refining your problem statement, you should be very specific on what the problem is. The reader should not be left guessing what the problem is and why it's important. It should address relevant literature. It should conclude with the purpose of the research to solve the problem. Also, you need to demonstrate what significance this research study has on medicine, nursing, and the military if applicable. You need to tell the reviewers and the readers the so what, why do we need to give you money to do this research study. Also, the problem should be feasible. I think this last point is very important. Many novice investigators, what we call try and solve world hunger. They end up having a research question that's not very specific, not very focused, or they want to answer multiple research questions in a single study. When you're first starting out, key to being successful early on is to keeping your study simple and not making it too big or too complex, because that increases the chances that you may not, just makes it more difficult to complete the research study when you're first learning. You want to make sure that it's feasible to conduct the study. And if a reviewer is reviewing your grant and based on the review will determine whether or not they give you funding to complete the study, if they don't think that it's feasible, they may not give you the money to complete that research study. Also, finally, you need to make sure that it's written clearly. And if you need assistance with writing, I recommend you go to your local command, or if you're at a university, and seek out that help with writing. Thinking of a problem area and formulating a problem statement and research questions, this is really a creative process. When you talk with investigators who've been doing research for a long time, you see that these are really creative people. And what you'll find is that there's a lot of ways to get an answer to a problem. There's a lot of different research methodologies and a lot of different ways that you can answer that question. Many times what you do is you start out general and then you narrow your focus down to something specific. For example, maybe you're interested in doing a research study on postoperative nausea and vomiting, but that's a pretty large topic. Maybe you're interested in women undergoing gynecological surgery and you want to see if administering a new medication decreases the incidence of postoperative nausea and vomiting. You might even further narrow that down to only looking at women with 3 or more risk factors for postoperative nausea and vomiting. So the problem statement provides a specific focus for the project. It tells the reviewer and the reader, all right, what are they planning to do in the study? Why is it important? And it's critical that if you're a novice investigator, that you seek out consultation and mentorship from an experienced researcher. When developing the problem statement and your research questions and your specific aims and hypotheses, what you'll find early on is that it's an iterative process, meaning you're going back and forth between the literature and your problem statement. You might first start out by writing, okay, what is the problem and what is the question I want to answer? And then you go in and review the relevant literature, and as you're reading that literature, you may further refine, rewrite that problem statement, that research question, and you keep doing this multiple times until you get to a really good, polished, clearly written, very specific problem statement and research questions. So when you're conducting the initial literature review, you're wanting to see what is out there. When you're reading the literature, you want to see what theoretical or conceptual approaches did people take. Did they use specific theories or conceptual frameworks to help guide the research study? if you're choosing to use a theory or a conceptual framework in your research. Also, you need to see how they went about answering their question. What methodology did they use? What type of instruments did they use? How did they operationalize their concepts? How did they measure what they were interested in measuring? How did they conceptualize the problem? Did they look at it a certain way? And maybe you want to look at it a different way. The significance. You need to think when writing the problem statement, what are the benefits, short-term and long-term? Will these results be applicable to practice? Will they help generate or support new theory? So what? What do your research findings mean? The important part of developing a problem statement and writing your background and significance is you're trying to sell your research study to somebody. If you're applying for grant funding, this is really important because how well you can demonstrate the so what factor. Why is this important? How does this meet identified gaps in our knowledge? If you can clearly articulate that, then you have a higher chance of getting funding, getting your study, or getting your study approved. Will it modify policy or make patient care safer? Also, as I mentioned, you need to make sure the study is feasible. You're not trying to solve world hunger. And here's some things that you need to think about that will help you in determining if your study is feasible. First, you need to think about, is it ethical to do the study? Are the participants available? Do you have access to the population? Maybe you are a graduate student at a college of nursing working on your PhD, and maybe you're interested in studying stress in enlisted submariners attending submarine school. Well, maybe they don't have a submarine school in your area, and you need to travel to another location to do that. So you need to think of how you're going to get access to the participants. If you're working in the military, you need to get permission to access certain populations, and you need to find out who those key stakeholders are. You need to determine, do you have the appropriate facilities to execute the study? Do you have the available equipment? What are the costs, both direct and indirect? Are you going to have to pay a research assistant to help complete the study, or are you going to be doing the data collection yourself? Do you have to pay for medications or patient care? Do you need to pay for copying expenses? Those are all things that you would think about and consider when determining, is it feasible to do your study. Also, a big step is, how long do you think it's going to take to do the study? And when you're thinking about this, you need to, one of the things I tell new investigators is that it's better to, if you think it's going to take you 6 months to get the study done, a rough rule of thumb is you might need to add 2 to 3 months more onto that. If you think your research study is going to go smoothly and you're not going to have any problems with the IRB, you're probably mistaken. In general, in most institutions, this may vary, but at Naval Medical Center San Diego, our average time to get a research study through the Institutional Review Board can be anywhere from 60 to 90 days. Now, the reason for that is that it gets reviewed at multiple levels, and the final approving authority for the research to be conducted is the commanding officer of the military treatment facility that you're located at, or that has oversight over the Institutional Review Board. So you always need to add extra time onto your timeline, and I think it's a good idea to look at a calendar and set out your timeline and really look at what your milestones are, and as you're conducting your study, you need to see if you're meeting your milestones, and if not, you need to maybe adjust your timeline. So the final problem statement is typically an interrogative statement. Sometimes it's written as a question, and the answer to that question will solve the problem. Also, it may help lead to further research. It clearly identifies the variables under investigation. It expresses the relationship between the variables. It specifies the population being studied. And it implies empirical testing. Here are some more components of a problem statement. As we mentioned earlier, will include an independent and dependent variable, if applicable, the population, and it should demonstrate that the study is feasible and suggest a possible research design. For example, postoperative nausea and vomiting is a pervasive problem following general endotracheal anesthesia. Now, this problem statement is not very specific. So, as the investigator was preparing this problem statement, they further expanded on the problem statement, and they said postoperative nausea and vomiting is a pervasive problem in female patients undergoing laparoscopic procedures. So you can see that the investigator is interested in postoperative nausea and vomiting, and has demonstrated, at least suggested it's a problem, and that he's suggesting a patient population, in this case women undergoing laparoscopic procedures. And then they further refine this problem statement to say this, that multiple risk factors have been identified that place certain patient populations at higher risk for postoperative nausea and vomiting. So you can see how they're maybe focusing the problem even further and clearly trying to define the problem in what's called a problem statement. And in this slide, I give you an example of a problem statement that was written up in a previous study. Please take some time to read over this and feel free to pause this podcast and restart when you're ready. I'm going to read over this problem statement for you now, and I'll point out a few things that I get from this. So postoperative nausea and vomiting is the most common complaint following surgical anesthesia. Despite the advent of new technology and pharmacological agents, the incidence of postoperative nausea and vomiting following general anesthesia remains 20 to 30% in general surgical population. And when certain risk factors are present, the incidence of postoperative nausea and vomiting is as high as 87%. So you can see right off the bat they're introducing, the writer is providing evidence demonstrating what the problem is. In this next part of the problem statement, they're going to start talking about some medications. So they go on to say, ondansetron is effective in reducing the incidence to approximately 40% in these high-risk patients and has a favorable side effect profile. The incidence of postoperative nausea and vomiting can be further reduced when ondansetron is given in combination with another antiemetic agent. However, these combinations can be costly and typically results in significantly higher incidence of side effects. So you can see in this problem statement, the writer has introduced the problem, introduced the scope of the problem, discussed the incidence of the problem and some current therapies, and starting to transition and demonstrate where the problem lies. In this case, they're saying that some of the medications that we currently give to treat postoperative nausea and vomiting can be quite expensive, and they may have higher incidence of side effects. In this problem statement, they continue to go on stating that meclizine is a cheap antiemetic agent that is typically given for the prevention of motion sickness and has recently demonstrated a prophylactic antiemetic quality when given to the surgical patient. To date, there are not studies that have determined the efficacy of prophylactically administered ondansetron and meclizine to groups of patients identified as high risk for postoperative nausea and vomiting. So you can see they conclude with, you can see that they're introducing a potential new intervention that they may be investigating in this study, and they're demonstrating that there's gaps in the literature, and in this case, there's no studies that have determined the efficacy of combining ondansetron with meclizine in patients at high risk for postoperative nausea and vomiting. So this is a good example of a well-written problem statement. So from your problem statement, typically at the end of that, you're going to end it with a purpose statement. And this is a broad statement of the purpose which establishes the direction of inquiry. Typically 1 to 2 sentences in length. It identifies the key variables and the nature of the population of interest. And it suggests the manner in which the researcher seeks to solve the problem. So I want you to identify the population at risk, the independent and dependent variables in this following example of a purpose statement. And I'll read it to you. Therefore, the purpose of this investigation is to determine if the prophylactic administration of meclizine and ondansetron will result in a decrease in the incidence and severity of postoperative nausea vomiting in a group of post-surgical patients identified as high risk for postoperative nausea vomiting as compared to a group given ondansetron plus a placebo. So the population at risk in this example are patients identified as high risk for postoperative nausea vomiting. The independent variable is meclizine and ondansetron, and the dependent variable is the incidence and severity of postoperative nausea and vomiting. So out of this purpose statement would flow the research questions. And you might have several research questions to address this problem. One may be looking at the incidence of postoperative nausea vomiting. Another may be looking at the severity of postoperative nausea vomiting between patients given the meclizine and ondansetron as opposed to ondansetron plus placebo. So the research question is a rewording of the purpose statement. It's phrased as a question. And as I mentioned, it identifies key variables, both your independent and dependent variables, suggests a relationship between them and the population. A hypothesis, on the other hand, states the relationship between the two variables and describes the population. It's written with a simple, clear, and concise language. And there's a difference between a research hypothesis and a statistical hypothesis. A statistical hypothesis, you can think of that in terms of being the null hypothesis. And when we're doing statistical tests, we're trying to disprove the null hypothesis, meaning that there is no relationship, there is no difference between a group given one drug versus another drug. Whereas a research hypothesis can be written either as a directional or non-directional in terms of you're trying to state what is the relationship between our independent and dependent variables in this given population. A directional hypothesis, here's an example. Those patients given prophylactic ondansetron and meclizine will have a decrease in postoperative nausea and vomiting. So you can see in this example, this is a directional, and the investigators are hypothesizing that patients given a combination of ondansetron and meclizine will have a decrease in postoperative nausea and vomiting. They might go on to continue this hypothesis in saying that those patients given prophylactic ondansetron and meclizine will have a decrease in postoperative nausea and vomiting as compared to patients given ondansetron plus placebo. A non-directional hypothesis might be written such as this one. There is a relationship between the presence of risk factors and postoperative nausea and vomiting in a surgical patient. Now this is just an example, and it would need to be written a little more specific if you were putting this in a research proposal. But I think you can get from this that you can see that we're not stating that there is a specific direction in which we're going. The importance of how you write your hypotheses as either directional or non-directional is important because this may determine whether or not you use one-sided statistical tests or two-sided statistical tests. If you're thinking of developing your problem statement, your purpose, and your research questions and specific aims, typically what at the end of your introduction and your background significance in your research proposal or in your grant proposal on your first page, you're going to conclude with maybe the purpose of this proposal and then maybe present some research questions and or specific aims or research objectives followed by some hypotheses if applicable. An important point I want to make here is that how you write these, whether you write research questions, specific aims, hypotheses, may depend on the application that or the organization you're writing to. If you're submitting a research grant, your first page is going to be your specific aims page, which is essentially going to be your problem statement and some background. and demonstrating the significance of your study, and then what your purpose is, and then you're going to list your specific aims, what you plan to achieve with this study, and some research hypotheses if applicable. If you're reading a research manuscript that's published in a peer-reviewed journal, typically at the end of the introduction, the investigator will present their purpose statement, what is the purpose of the study, and they may state what their primary aim was, and they may have one or more secondary aims. Typically, when you're designing a research study and you're thinking about sample size, many times you will base your sample size calculations on your primary aim. Here are some general tips that can help you when you're formulating your research questions. You need to be careful about the choice of verbs. The verbs clue to the design and the analysis. For example, if you're writing your research questions or your specific aims and you're writing to describe or explore, then that might lead the reader to think that you're going to use a descriptive type design. If you're determining the relationship, that may suggest a correlational design. If you say predict, that may suggest you're going to do some form of regression analysis. And if you see, is there a difference, or maybe you see one group is higher, or they say someone given X drug will have lower pain scores, that might suggest that you're a randomized controlled trial or you're doing some sort of experimental, comparative, or quasi-experimental study design. The way you write those questions, as I mentioned, will help determine the expected relationships, and they should not be written as the null or statistical hypothesis. Now there's different levels of research questions. Level 1 research questions are descriptive or observational type designs. And we're going to see some examples of how these are written shortly. Level 2 type research questions are getting a little more advanced. This is when you have some background information, there's already been some descriptive or observational studies, and you're just looking at comparing relationships. For example, we did a past study where we were interested in looking at preoperative stress in patients coming in for elective outpatient surgery. And we operationalized preoperative stress two ways. One with psychological stress using some psychometric tools of stress and anxiety. And we also used a biomarker to evaluate the physiologic stress response. And then what we did is we wanted to determine the relationship between the physiological and psychological stress patients experience that are presenting for elective surgery. And this would be an example of a correlational design. A predictive or causal design is when there's a lot more knowledge on a topic. And this can better answer the why question. And typically these are thought of as experimental designs, such as what we talked about earlier when we were talking about the meclizine study, or predictive hypothesis type designs where maybe you're doing some form of regression analysis. The next couple slides I will present a taxonomy of research questions and hypotheses. The nice thing about these slides or this taxonomy is that you can use them when writing your research questions and your hypotheses. All you need to do is fill in the specific information, and you can modify and tweak them. For example, you can see at research question 1, what are the general characteristics of? Maybe what are the general characteristics of pain scores in patients having orthopedic surgery? Or what are the characteristics of the typical, and then it goes on to describe the sample. And what are the characteristics of a sample consistent with the population characteristics? And they may hypothesize the characteristics of the sample are consistent with the population characteristics. You might see another question here, what is the relationship between variable A and variable B? And you can see how they've written it as, variable A is related to variable B, meaning non-directional, where in hypothesis 2 at the bottom, variable A is positively or negatively related to variable B. You can go on and see another example here. What is the effect of variable X on variable Y? And you can see different ways that you can actually write your research hypotheses. Or you can have what is the relationship between variable A and B when the covariance from variable C is removed from A and B. And you can go on and you can pause this podcast and read further through this, and maybe think in your mind some different way, fill in the blanks, fill in, see if you can practice writing some different research questions and hypotheses using these as templates. And the slide further goes over some examples of how you can write research questions and your subsequent hypotheses. Again, feel free to pause the podcast and resume it when you're ready. So now we're going to go over an exemplar. A recent study that we submitted to the IRB and that we're currently conducting here at Naval Medical Center San Diego is where we're looking at administering gabapentin to patients undergoing inguinal hernia repair to see if this decreases the incidence of chronic growing pain. What I'm going to have listed here in this slide is some of the information that may go into the problem statement and in the background. So in this circumstance, there's a high incidence of chronic growing pain after inguinal hernia repair. And this may affect a soldier or Marine's ability to return to duty. So you can see here we're suggesting some significance or relevance to the military and why this study should be conducted. Multiple interventions and surgical techniques have been attempted with modest effect. So we had this was a statement in our background in our problem statement. And then we went on to state that gabapentin has shown some efficacy in decreasing neuropathic pain after inguinal hernia repair. So the purpose of the study that we conducted was to evaluate the efficacy of a short course of gabapentin on the incidence and severity of chronic growing pain in men after inguinal hernia repair. And in this example, our independent variable was a short course of gabapentin. In our methodology section, we would further specify or clarify and operationalize what a short course of gabapentin therapy is. Our dependent variable in this purpose statement was the incidence and severity of chronic growing pain. So we might then, when you're writing up your methodology and statistical analysis section, we would need to clarify how we're going to determine the incidence and how we're going to determine or measure the severity of chronic growing pain and when. And in this purpose statement, the population that we are interested in studying were men undergoing inguinal hernia repair. So our first research question in this investigation was, is there a significant difference in the incidence and severity of chronic growing pain at 1, 6, 12, and 24 months in men undergoing inguinal hernia repair who receive a short course of gabapentin or placebo? Now if we go back to the previous slide, you can see our purpose of this study was to evaluate the efficacy of a short course of gabapentin on the incidence and severity of chronic growing pain in men after inguinal hernia repair. You can see how that's written a little bit more general, but it does clarify our independent, dependent variables in our population. Then, as you go to your research question, you're getting a little more specific in terms of telling the reviewer what you're actually looking at and when. So in this case, we're going to look at the incidence and severity of chronic growing pain at 1, 6, 12, and 24 months in patients that are given either gabapentin or placebo. If you were to write this, if you take that research question and then write a specific aim or what you intend to accomplish, in this case we were going to compare the incidence and severity of chronic growing pain, usually in this case using a verbal numeric rating scale at 1, 6, and 12 and 24 months in men undergoing inguinal hernia repair who receive a short course of gabapentin or placebo. So you can see here we're more specific and we're stating what we intend to accomplish. And we actually present how we're going to operationalize chronic growing pain. In this case, we're using a verbal numeric rating scale. And because this was our primary aim, we would use this to base our power analysis on. And if we were to write that specific aim as a hypothesis, we would write it as such. The incidence and severity of chronic growing pain after inguinal hernia repair at 1, 6, 12, and 24 months will be lower in men who who receive a short course of gabapentin as compared to placebo. So you can see that this is a directional hypothesis, and that we are hypothesizing that these men will have less, the incidence and the severity of chronic groin pain will be lower at these time points. You also can see that this type of a hypothesis suggests a randomized controlled trial with a repeated measures design. Our second research question: is there a difference in the quality of life at 1, 6, 12, and 24 months in men undergoing inguinal hernia repair who receive a short course of gabapentin or placebo? So in our first research question, we are interested in the incidence and severity of chronic groin pain, and our secondary aim was looking at quality of life. And to take that research question and write it as a specific aim, we would write it as such: to compare quality of life using the SF-36 at 1, 6, 12, and 24 months in men undergoing inguinal hernia repair who receive a short course of gabapentin or placebo. So in this study, this would be our secondary aim. And then if we wrote that as a hypothesis, we hypothesized that quality of life scores on the SF-36 at these time points will be higher in men undergoing inguinal hernia repair who receive a short course of gabapentin as compared to placebo. So when we developed this research study, you're probably already thinking, and I already alluded to a potential research design. So in this case, we used a randomized controlled trial with repeated measures. And then in our methodology section, we would define or operationalize what we meant by a short course of gabapentin. In this case, a short course of gabapentin was 300 milligrams of preoperatively, then 3 times a day for 72 hours. Chronic groin pain was evaluated with a verbal numeric rating scale, and we evaluated this 2 ways. Both we looked at the incidence of chronic groin pain, and in this case this is the percent of patients with a pain score greater than 1 at the various time points, and then we looked at the absolute severity of the pain score. In this case we might look at present or report the mean and the standard deviation of the pain scores at the different time points, and use a repeated measures and analysis of variance to compare those pain scores. And then to measure quality of life, we used the SF-36, which is a standardized instrument for measuring quality of life. Here are some resources that I used to make this podcast. The first book by Tornquist is an older book, but it's really an excellent book for helping you prepare a proposal from proposal to publication. And I recommend this to any novice investigator or even an experienced investigator who wants a simple and easy to read book that helps teach them the research process. And it doesn't matter whether you're a physician, nurse, physical therapist, this is really an excellent book that I highly recommend. And another good resource is by Wooden Ross Kerr, which are the basic steps in planning nursing research from question to proposal, the 7th edition. This was recently published in 2011. This is another excellent book. It's written more in a narrative format, and it really walks you through developing a research question and all the way through completion and preparation of the proposal. Thank you.